it is my great honor to now welcome to our podium a great friend of mine and of this organization. I think one of the greatest leaders for our values in the country today. You probably first got to know him on television, but Dr. Mehmet Oz, even though he had an extraordinary career with the Dr. Oz show, winning 10 daytime Emmys, winning in the ratings every day in his time slot. He is also one of the more accomplished heart surgeons in our country, ultimately serving on the faculty of the Columbia University Medical School. He developed innovative treatments for patients suffering from heart disease. I first got to know him when he ran for the U.S. Senate in Pennsylvania, Faith and Freedom, and I think we have some folks from Pennsylvania here. Yeah, I knew we did. And these folks and lots of others knocked on about 750,000 doors for Dr. Oz when he ran for the U.S. Senate in 2022. We came up a little short that year, but how many of you know that when one door closes, God opens another door? Amen? And the president tapped Dr. Oz to direct the Centers for Medicaid and Medicare Services. Because he's a physician, he so understands healthcare. He's helping to reform and improve the healthcare system and lead the Make America Healthy Again agenda under President Trump. He took the lead in sitting down with insurance companies and pharmaceutical companies to cut the cost of prescription drugs for our seniors. He is a great American. He's a defender of faith and freedom, and he's a really good friend of this organization. Please welcome the President's good friend, our good friend, Dr. Mehmet Oz.
Thank you very much. I appreciate you very much, Ralph. You mentioned the show. On the show, we talked frequently about faith and talked about freedom. We added family, there were 4 Fs, and then we had food, and they actually fit together pretty well. Any of you here on Monday, we have Maha Mondays now taking place at the Great American State Fair, and I'll be hosting different chefs and folks who have a fair amount of prominence in the world of health in America, talking about the reality that your basic fundamental health is so much a part of the faith that you have, because you're ultimately taking care of the temple of the soul. And I want to speak a little bit about that, because putting on my doctor's hat or jacket, it is an unfortunate reality that we have to give people news they don't want to hear sometimes. And in medicine, you're taught to do that in a variety of different ways. One of the best ways to do it is look people in the eyes, make sure they realize that you care about them, not their disease, them as a patient. And then you can sort of get into the details of the issues that might be plaguing them and the ways that you can help them. Now, I'm going to say this is a reality that a lot of folks, sometimes when they enter into politics, forget about. And so we don't like to give people bad news, but because part of my job is to make sure that you're well aware, please take it with love that I'm trying to give as I start to share some of these realities. We've got a major crisis in our healthcare system. It's a fixable one. I'm going to walk you through a couple ideas that might change your thoughts about where we belong, but we are twice as expensive to take care of as a people as any other country on the planet. We spend a lot more money on chronic illness. We have issues that have hurt us, but a lot of it stems down to the atomization of our people, the fact that we're flying away from each other in ways that we never thought possible. And there is a precious covenant that a doctor has with their patient and that we should have with people in our lives. And that covenant, actually, although the fundamental Hippocratic Oath comes from the Greek, the covenant concept is one from the Bible, that there's a sacred role that you have to be with people. And if you can get that covenant to be part of your guiding principle in life, and I'm going to speak to that in several different ways, then you can actually weather the storm of criticism when you're sometimes giving people news that, again, is not that comfortable. And as you look at the reality of healthcare, the bureaucratic hassle that many of you face, the rising costs, the fact that chronic disease, which drives 70% of our budget, is endemic in America. I mean, many people can be seen by Google Earth, which is an unfortunate reality, because when you put on a lot of weight, it complicates almost everything else in your life. Many of these are addressable. We have some ideas that will be impactful that we're actually rolling out this year and have already started. But we have been losing the covenant concept in medicine. And it's one of the reasons I think doctors have lost their mojo. And it's one of the reasons that I think we as a people can do a better job as we take care of each other. Because it's not just happening in medicine, it's happening culturally. And the trust in each other is ultimately what drives the success of the covenant. We see this decline in politics most, obviously, and the president will speak to that this afternoon, but it trickles down to communities where neighbors, they're used to care for each other and be part of each other's lives, have changed their impression. So Ralph mentioned I ran for Senate. One thing I realized talking to people on the campaign trail was the actual people you're speaking to generally feel good about life. They think they're doing well. They're worried about their neighbor. But if everyone thinks they're doing okay and it's their neighbors they're worried about, you realize that what's really happening is you're being tricked by a media cycle that's compelling you to believe something that actually isn't true. Because of that, fewer than half of all Americans now say they can trust the people around them in their neighborhood. That's down from 52% a decade ago, a significant, meaningful drop. Only about a third of people say that the average person can be trusted. That's also down about 10 points over the last 10 years. And part of the reason that we're seeing so much fraud in America is because people have stopped trusting that process and begun to think that everyone should be out there for themselves and take advantage of these beautiful social systems that were built. And this flies in the face of everything that we've been taught. Everything you've learned from Scripture, all the lessons taught in schools, you've heard from the pulpit, the things that should reinforce and cement the fact that we are hardwired to be with each other. 50% of our brain, if you just think about it, 50% of our brain is designed to look someone else in the eyes and be there for them, to communicate with them. And when you ignore that part of who we are because you've been pulled in the different directions, including social media, you actually hurt the ability of human spirit to fly and rise up and elevate all of us. I mean, the Good Samaritan story is a perfect example of what happens, right? You have two people who should have stopped, who didn't. That's where the story always got me, because the ones that should have made a difference, the ones who should have called out the fraud, for example, in the healthcare system, didn't do the right thing. And when good people don't stop evil, evil prospers. Now, thankfully, in the story, obviously, the Good Samaritan, who no one thought would stop or didn't really think it would matter if they stopped, did stop, bonded the wounds, took the injured Jew to the inn, and actually paid for his stay. So did all the things that you would want to do. I think we can do that. I'm seeing that day in and day out as I travel across the country administering CMS, Medicare, Medicaid. I mean, we cover 170 million people. So we get the government healthcare system gets to touch a lot of people's lives. I see the good out there all the time. We have to reinforce that, and we've got to take out the evil folks and nudge the people who could be good but aren't showing up in their lives and the lives of those around them to be able to get the most out of the system. Now, America was built on the same principle. And our founding fathers, obviously, were Christians, and they had tremendous wisdom. Many of you know the famous founding fathers. I don't know how many of you know Benjamin Rush? Put your hands up. A couple people. Benjamin Rush was a doctor. There were a couple doctors who signed the Declaration of Independence. He was a founder, doesn't always get the recognition that he deserves, but he had been incredibly effective in helping push forward the Declaration of Independence. He was also a professor of chemistry, first, by the way. He's the father of American psychiatry. He was involved in a lot of things, but he was also a philanthropist. And so when there was a yellow fever outbreak in Philadelphia, and of course, back then you just left the city, you'd run away. And he was in Philadelphia, for all the Pennsylvanians in the audience, I heard Ralph call us out, that he stayed and took care of people in the yellow fever epidemic. He got yellow fever, survived it, thankfully, made house calls, built huge charitable endeavors. He did all the right things, a good role model for many of us. I think we sometimes forget those examples out there in our history, those archetypal stories that should engender us to go to new heights. So let's apply this to the actual workings of CMS, where you actually can apply faith in unique ways. At CMS, we have a vision to transform care is based on a few principles. Amongst them, obviously, the reality that the most expensive care we give is bad care. Because if you give people, pay someone to do something that's a poor job, then you have to pay someone who's qualified to fix the problem. Then you got to pay someone downstream costs to make sure that things work out well. You spend a lot of money without getting your money's worth. So at CMS, as you walk into the building, there's a beautiful quote from Hubert Humphrey. And the quote says, and again, he said this in the 70s, this is true today, it is the moral test of government to take care of those at the dawn of life, our children. And remember, most kids in America are born into government insurance, so 53%. To take care of our kids, those at the dawn of life, those at the twilight of life, our seniors, and those living in the shadows. Think of that haunting metaphor of light defining where you are in your life cycle. And people in those different camps, the dawn of life, twilight of life, and the dawn of life, all have opportunities. Our job is to give them the tools to get on the playing field of life. And without your health, you can't do that. It's one of the reasons that we've been so focused on the MAHA movement. So what is the Make America Healthy Again movement about? I'll define it in one word: curiosity. Now, curiosity, remember, that's not as easy to be curious as you may think. 80% of questions are statements in disguise. So most people aren't as curious as you might think. But if you actually could get your curiosity to be the driving force behind a lot of the things that you're worried about in your family's health, you actually then might be courageous enough when you learn things that are important to apply them in ways that make a difference. So if you're curious and you're courageous enough to take the information you've learned and share it, and you're compassionate as you do that, so that you can say it in ways that people aren't offended by, you can start to get change to happen. And I think the biggest problem the MAHA movement is addressing is, why does the average mother today feel like it's harder to raise healthy kids than it was for their parents to raise them? That's the fundamental question that's being asked by communities all around America. And I think moms have a point. There are many things that have happened in our society. It could be toxins in the environment. It could be emotional threats that come from around us. It could be easier access to drugs and crime and lots of things that we should be protecting our families from, and which this administration under President Trump has fought hard to stop. But all of this comes back still to the building block of the family. That's why at CMS we're trying to empower people with better tools so they can manage their health in ways, meet them where they are, and give people tools to prevent illnesses. I've mentioned already the obesity epidemic impact, but if we can't take the obesity numbers down to where they are in the other parts of the world, we're always going to be more expensive to manage. It's one of the reasons, and Ralph mentioned this, that the president wanted us to negotiate better drug prices. Let me just put this in context. Almost a third of Americans, when they go into a drugstore and they enter their building with a prescription that their doctor gave them, will leave empty-handed because they cannot afford the medication. This is an affordability issue that's bigger than eggs and meat prices, and I'll tell you why. Because if you cannot buy health for your family, you don't feel like you own a piece of the American dream. That's the moral test that Humphrey was speaking about. And so the president said, why is that happening? Why is it so expensive to have drugs in America? It turns out part of the reason is that pharmaceutical companies were charging Americans on average 3 times more for the exact branded drugs, made it often in American factories, than they were selling those same products for overseas. And so the president said, no mas, that's enough. You go to these guys and knock on their doors and you tell them, we're done paying 3 times more for the exact same products. And you know what they all said to the last person, to the major companies? We knew one day you'd come. We knew one day you'd ask us to give back the money. And they have. They have signed contracts. These are most favored nation contracts, which means we get the same price as anyone else in the world. We're not telling them what to charge. We're not telling them the price is fixed, because we don't want to hurt innovation. We want these companies making life-saving drugs, curing cancers. I was at the Children's Hospital here in Washington this week. There are kids running around there. They would have died 5 years ago. They're being cured by new technologies, again, made possible by these innovative companies. That's fantastic. But what the president said is that you can do that, save lives with innovation, at the same time give us the same prices you charge everybody else. And now we're doing that. No more global freeloading. Those programs have taken off. All those medications are available on TrumpRx.gov. If any of you have any questions about this, if you go to a drugstore, most of the drugs that you might buy in a drugstore, you should at least check TrumpRx.gov to make sure you have the right price. Again, it's a website, it's our government's website. We're not charging anybody anything. Just use it as a transparency tool. But you know what? If you walk in the drugstore and the price on TrumpRx.gov is better, just take the coupon on your phone or print it out and just give it to the pharmacist. They've got to give you that price directly from the company. Cuts out the middleman. So TrumpRx.gov is an example of one of those things that we've just made a big move on and solidified what we thought was the right thing to do for the American people. And as part of that decision process, the president went further. He said there are parts of the country that are being left behind. So if you live in rural America, how many of you live in rural America? Let me see a show of hands. Oh, quite a few. So rural America's life expectancy has dropped quite dramatically. It's unfortunate because your zip code should not be your destiny, but that's what's happening. And so we put $50 billion in the rural health care in this country. That's that much money over 5 years is 50% more money than Medicaid ever puts in to the rural healthcare system. And we're changing rural healthcare in that way, meeting people, again, being a good Samaritan, driving change through the rural communities by allowing them to right-size their systems, by allowing big institutions to adopt smaller institutions, putting more folks with medical or nursing degrees into these communities, allowing rural America to enjoy the same high-quality health that's available in urban America. All this makes sense because we've been able to, please do applaud us for that, because that's something the Congress pushed for. And I'm going to pay him credit because he's speaking to you next. Dave McCormick, a superb senator from Pennsylvania, was one of the leaders. Yeah. Did a great job pushing to make sure that bill and others have gotten through. And the Working Families Tax Cut legislation was an extraordinary piece of legislation. The president got through and will change America and right-size not just rural health care, but Medicaid and other programs. Let me leave you with one little idea because it comes up a lot. Fraud, waste, and abuse. We are losing $100 billion a year from fraud, waste, and abuse. And I don't want to sour the mood in the room, but I do feel that it is almost our righteous duty to go out there and root out these folks. They are devils who are stealing health from our most vulnerable. If you're willing to steal money from people when they're on their low rung of the ladder, when they're struggling and often in debt, if you're willing to steal money from them, you'll steal their health, you'll steal their lives. So we are stopping that down in a big way. And give you an idea how important that is, if we could stop that $100 billion of fraud that's taking place in Medicare and Medicaid, we would actually double the life expectancy of the Medicare Trust Fund. Imagine the power of knowing that the social safety net that was built for you 60 years ago, crafted so that your hard work would allow you in your older years to retire with full knowledge that your healthcare expenses are covered. Imagine if that protection was doubled, and all you had to do was stop bad guys from being bad guys. Which again brings me back to the Good Samaritan story. Because as a little kid, when I'm, like most kids, hear the story, I focused actually not so much on the Good Samaritan, but why those other two people walked by that injured individual on the street corner. Do not walk by your fellow American. Call out people who do not call out evil. God bless you all. The Faith and Freedom Coalition. Thank you very much.